Hi everyone, my name's Rose of Dawn and welcome to the second part of my facial feminization surgery series. So last week I uploaded a video just before I went under to have my operation. So just to let everyone know, it all went completely fine. In this episode I'm going to discuss how the past week has gone, and you also get to see exactly what I look like now. So let's get this started.
Give it up, gonna be all that's gonna be. Give it up, gonna be alright.
So it's been almost 2 weeks since the surgery and this is now what I look like. It might not seem much of a change if you just looking at me now as the way I am, but if you compare the way that I look now to an older photo, you can see the differences. So just to point them out for you, probably the most obvious is my hairline, because there is currently a bit of a red scar there, which is here. So there's a bit of scabbing there. Unfortunately, I wasn't able to prevent that, but that's going to go away over time. It shouldn't be, by this time next week, it should be much less obvious. But also my eyebrows, if you notice, they are now higher than they were. So they've been lifted. And also my cheek implants, which are here, which presents a more rounder face. They're nothing major, but as an overall, just the difference that they've made is absolutely incredible. Now, I want to go into a bit more detail on that later on, but I just want to discuss the last 2 weeks and just kind of give you an idea of everything which I've been through. And if this is something which you're considering going down yourself, it might be quite useful to know. As I mentioned in my last video, my surgery was on the 28th of January. Now, this was done in the Queen Anne Hospital in around Harley Street, so the quite expensive medical area of London. The hospital itself is tiny. I don't know why I was expecting anything the size of an average hospital. It's literally just a couple of rooms. It's only for private patients, and as far as I'm aware, it's only for cosmetic surgery. So I had to arrive there at 7:30. I got there a few minutes earlier, but they were able to let me in. They then took me to a private room, which all their rooms there are private anyway, but the one which they took me to was the bigger one, which is quite nice. But I didn't have a lot of time to relax. I had to sign a couple of documents, had to do a urine test to make sure there were no illicit substances in my system. Thankfully there wasn't. And it was around 8:30 that they then decided that they were going to operate on me almost straight away. Actually going under, it wasn't the most pleasant anaesthetic I've had, admittedly. I wouldn't say this is necessarily the fault of the people there, because there was quite a lot of medical people around me. There was the chief anaesthetist, there was 1 or 2 nurses, and there was also some of the consultants from London Transgender Clinic were there as well. So there was a lot of people to give support. It just took them a while to actually make sure they got the right area of my hand to put it in, and that was quite painful. Now, so eventually I went under, and I think the procedure took in total 3 hours. So I woke up around almost 12 o'clock, and this is where things kind of went a little bit downhill, because I woke up with the worst sickness I've ever had following an operation. I could not stop vomiting. Within 5 to 10 seconds of coming to, needed a bucket straight away, and it just wouldn't stop. Now, they gave me every anti-sickness that they could possibly think of. They put things into my IV, they gave me a patch which went behind my ear. They even got this injection from somewhere and then just stuck it into my thigh. None of that worked. And it was at this point that I was told that I needed to be well enough to leave by 4 o'clock in the afternoon. That had not been communicated to me until that point. So that put a lot of pressure on me to start feeling better and to get out in time. I didn't make it out at 4. I was very sick. And this just continued. They would bring over a cup of tea, it would go. But I think it eventually started to calm down later on in the evening, and I think one of the things which kind of really made me push was that they informed me that if I was to stay overnight, it would cost thousands of pounds. I mean, of course it would. I'd be the only patient there. They would have to get in medical professionals. They do charge a lot of money. And so I kind of just made myself really keep it in. I was not sick afterwards. It took a while for me and my friends to get a taxi back home. And then finally I was able to get back into my flat and relax. The hospital stay overall, ignoring the sickness, I would say it was a bit mixed. So when I got the care, they were brilliant. They would really listen. They were really nice. They would do things for you. But I think they were a little bit too busy. When I said that I didn't leave at 4, one of the reasons for that was because there was just no one to be seen anywhere. People would appear and disappear as time went on. Mr. Inglefield would go off for other consultations. I remember he went for a lunch break as well. You know, things he's going to be doing. So there wasn't always someone there if I needed them. When they were there, they were great. They did a good job. So when I got back home, I was in quite a state. I wasn't really able to do anything productive at all. I had so many drugs in my system, and I was given so many different drugs to take home with me. And all I could really do is just sit there and not sleep and just kind of stare. Now, I was on a lot of medication at the time. I was taking tramadol, as I've previously mentioned. There was some antibiotics. There was some steroid tablets, which were quite big. And on top of that, there was general things like paracetamol. I was quite dosed up. And so the Tuesday, with the exception of going to the bathroom, the most I did was I shook my protein shake tab thing a couple of times so I could have something to eat and drink. And then I switched on my TV, switched on my Xbox, put it onto YouTube, and then I couldn't even choose anything to watch because my mind was so gone that I was just a zombie. That Tuesday was a complete write-off. I felt very, very sore. I still had my bandage on because that wasn't able to be taken off until Wednesday. That was one of the worst days I've had in terms of recovering from surgery, second only to the day after I had my gender reassignment surgery. That was worse. Eventually on the Wednesday, I was able to take off my bandage, which was quite easy. And then I got to see exactly what I looked like for the first time, but I was very swollen. And this was a lot more blatant, so that kind of gave me a bit of a shock. But I had to start all my care straight away. So I was washing straight away as soon as I took off my bandage. I had to wash my hair, and I had to wash it using baby shampoo. Now, I have now grown to hate baby shampoo because it just kind of reminds me of quite a difficult week. Then otherwise it was just resting, taking the drugs, and using the high-low therapy machine, which I showed the unboxing of last week. Now, this was quite tricky, and one of the big problems which I had was that I wasn't actually given the mask when I left the hospital on the Monday. They only gave it to me on the Wednesday. I managed to call them on the Tuesday somehow and let them know. They sent it via recorded delivery. When I plugged in the mask for the first time, it got a lot of air bubbles in it, and there was no way of getting rid of them. And so the Wednesday and the Thursday, I was too gone, so I couldn't figure out how to get rid of it. On the Friday, I called the high-low firm people, and they were no help. They couldn't tell me what to do. Eventually, I figured out a bit of a hack. If you're going to be using a high-low therapy machine, this might be quite helpful to know if it gets bubbles in it. So, when you have the pipes that go into the mask, so here is the mask, this is what it looks like, and here are these two pipes. So the idea behind high-low therapy is that it shoots water all throughout these, and then comes back out and it recycles it. So if this gets air bubbles, what you need to do is you need to have one of these plugged into the machine, one not. You switch it on, it will start pumping through and it will get rid of the air bubbles. Make sure you have a bowl or something to catch the water on the other side, because at least one of these needs to be connected, otherwise it doesn't work. That was able to get rid of the air bubbles, and it's from that point I was able to use it. Now, actually using the machine itself was great. It felt very cool on my skin, really kind of helped bring down some of the swelling. It was actually quite relaxing, especially because I think the swelling triggered a lot of hot flushes. So I would often feel very, very hot, sweating a lot, in particular coming down there. My face was, at times, would just be completely caked in sweat and it would be horrible. So having something cold to put on your face is able to help it. Now, I did have to take the machine back on Monday. Well, they came and collected it. That all went perfectly fine. I only really started to get out of bed properly, I would say, around Saturday. That was when I remember actually straightening my hair, trying to look a little bit more presentable because it'd just been a slob all week. So it was on Monday that I was finally able to leave the flat. So I went to the doctor to pick up my sick note. I went to a corner shop, and I also had my first follow-up appointment with the London Transgender Clinic, as well as a specific massage. Now, the massage is known as manual lymphatic drainage. So it's just very gently massaging various points of your face. It starts off there, then moves over to your face and back up to your scalp like that. So the idea of it is it's supposed to help circulation and kind of help reduce swelling and things like that. And I didn't actually know what to expect. I just, as part of all the letters I'd received, it said it's very, very relaxing. It's one of the most relaxing things you'll do. And they were actually right, it really is relaxing. Very nice. And that lasts for about 30-40 minutes. With the London Transgender Clinic, you get 3 sessions of it. I've had 2 of them so far. I'm having my 3rd one on Monday. So it was on Thursday that I was actually able to finally get the stitches out up here. And that was effectively given the all clear of I'm starting to, be well enough to start doing various things, including eating solid food. So one of the things which really stressed me out during my whole recovery was because the incisions for my cheek implants went through my mouth, I needed to eat soft food. Now, I initially took that as being yogurt, soup and protein shakes. But I went off soup very, very quickly. Maybe it's the soups. I'm not much of a soup person, to be honest. And I instantly started craving things like chips, like burgers, like junk food, really. So it's like, I've gone through a lot. You need to have something nice. And then it's like, no, you can't have any of it. So it's 10 days eating a very soft diet. I kept on increasing what it was I was able to eat. Eventually moved up to things like mac and cheese, chili, stuff like that. But I think it's important to start off very, very soft and kind of build it up, because you don't want to rupture any of the incisions in there and potentially risk an infection. It's important to stick with it. It is hard, but you'll eventually kind of make it through. So I would be lying if I said that this was an easy process that I've been through. In fact, I would actually say it's quite a difficult week. It certainly felt very intense. And one of the big problems with that is because all the work has been done on the face. When your face is kind of out of action, so are you. There's nothing you can do. I was hoping I could watch films and play video games, and for the best part of last week, I wasn't able to at all. Reading was too hard. I was nothing more than a zombie, and there were moments when I was really thinking, was this worth it? Why am I putting myself through this? I couldn't see the light at the end of the tunnel. I thought that it was pointless. This week, I've been able to start getting my strength back. I've actually been outside of the house a couple of times. I've still got recovery time to go, but right now, I've never been happier with the way that I look. And I know I've just moaned about how hard this has been, but I cannot describe the feeling of now being able to look in the mirror and what I see reflected back at me is exactly the way that I've always wanted to look, minus the scar. It's indescribable. It really is. This wasn't... I've seen people make comments about, you know, I've always been quite pretty, I've been good looking, and I've had lots of friends say that to me as well. Now that's all nice, but this isn't a vanity project. This isn't so I can think, oh, I can now meet lots of cute guys because I finally look all right. No, this is all about the way in which I feel inside. And that's what a lot of this kind of surgery really is. It's not a way of showing off to the world. And you can't put a price tag on it. Even though this did have a price tag, obviously, it's major. Just the way in which my life now feels it's changed. I still have quite a visible scar up there, but I don't even feel the need to cover that up. I'm so happy with the way that I look right now. I can just step outside, not think anything of it. This is the best I've ever felt internally. This kind of surgery is not going to be for everyone. There are people out there that may or may not need it. If this is something which you are thinking about, then I think it's worth going down that rabbit hole and seeing where it leads you. Because what you get done is small. And the recovery, as unpleasant as it is not going to last forever. It's only going to be a week or two, 3, whatever. And then you got the rest of your life. Being able to look at yourself in the mirror and see what should always have been looking back at you. I know that I'm lucky that I've been able to do this. I've had support, which I know a lot of people probably don't have. It's quite hard to really put it all into words, just what this really meant to me. So the point of this video isn't really to be going into a lot of detail as to what FFS really comes down to, or anything, or really answering any of the key questions, which I know quite a few people might have. But I do want to do more follow-up videos on this, and in particular I'd like to do one answering questions which people might have, so I think that might be the most helpful out there. What I want to say is, this has been an experience which isn't over, but already I feel the benefit. I don't think I've ever been happier, and you're going to be seeing me on camera a lot more, because right now I'm just looking right into the camera and I feel great. I feel normal, and that's the best feeling that I think a transsexual can have, is that feeling of normality. It's so rare. You know, there's been times where I've even got a little bit philosophical when I've seen people who are fairly trend-alike when it comes to their gender posting about how that, you know, how tough and difficult their transition has been when all they've done is come out as a planet and told their friends who naturally put them in a hug box and say, yes, your transition is just as valid as everyone else's. I've seen people saying, well, it's problematic for a trans woman to try and pass off as cis, and you know, you shouldn't be trying to pass, you should be openly being a tranny and that's about it. I've just spent about £13,000 looking to look like a normal human being. This is what transitioning is. It's about gaining a sense of normality about yourself. It is not about being trans. It's just about being yourself. If you have any questions about facial feminization surgery at all, I mean anything, please leave your comments down below. I will do a video and I will address them. And also just want to give a quick thank you to everyone who's been very supportive of me throughout, on whether it's in real life. I've had a lot of kind words from friends, as well as people on Twitter. You know, I know that I have quite a lot of gender critical supporters who, you know, they don't exactly get the best reputation when it comes to how they see trans women, and to have a lot of respect shown to me from that particular community genuinely does mean a lot, and it says to me that there really is a middle ground in which where we can actually work on things. Thank you all for watching, and I will see you all next time.